Hello, is this thing on?
Do you think they can hear us?
Nah. Let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie,
And my name is Sara.
and we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Hi, everyone. So thank you again for tuning in and listening to the Gritty Nurse podcast. We have a really wonderful guest today. And today we actually want to talk, but I think this is going to be a special episode. I'm looking forward to it. So Sara, can you jump in and introduce our guests, please?
Absolutely. We have a really special guest today. Her name is Dr. Amie Tan. She's a family physician and hospice palliative care physician in Victoria, BC, as well as a researcher, educator, and advocate in the realms of culturally safe medical communication, palliative care, and health equity. She is passionate about doing her part to dismantle inequities by teaching and advocating regarding organizations and people in healthcare to be accountable in their journey towards being truly anti-racist and inclusive so that equity for all people, regardless of race, gender identity, sexual orientation, abilities, religion, and class. She was named an Avenue Calgary's Top 40 Under 40 in 2017 for her work in advanced care planning and primary palliative care, and a compelling Calgarian for 2020 for her advocacy work in anti-racism, health equity, and equitable safety policies for the COVID-19 pandemic. That is really, really great. And also, Amie, you being a fellow Chinese Canadian, I feel like we have a lot in common in terms of our experiences. So I would like to welcome you to the show today.
Thank you so much for having me. I'm very excited to be having this conversation with both of you.
Thank you. And just to preface the just at the top of the episode, so because there are two Amies today, and that's unusual, we're gonna refer to Dr. Amie Tan today as Dr. Tan, not because we don't want to have anything too confusing, and that'll just differentiate who's talking at any given time. So could you maybe tell me a little bit about yourself, about your background and your history, and just a little bit about some of your experiences in regards to racism?
Sure. So I am Canadian born. I was born in Vancouver, raised and grew up in Richmond, BC. My parents immigrated 50 years ago from Hong Kong. And so, being a child of the late 70s through to the 80s in Richmond, BC, I was definitely what we would call a visible minority at the time. I don't remember any other uh, people of color in my friend group, in my teachers, etc. But then things started to change when I was in high school because leading up to the 1997 removal of British colonial rule in Hong Kong and the handover, as it was called, back to China, many people from Hong Kong started to come to Canada, and actually most specifically to Richmond, BC.
Mm-hmm.
And so during the high school years, we had many people coming from Hong Kong, and also it was interesting because they actually the kids in my high school, they would actually be living pretty much on their own, and their parents would go back and forth.
That's pretty common.
Yeah, and Richmond. So it was interesting because then started a bit of a shift in that I was perceived, and I realized this, but I was perceived as Canadian-born Chinese, so I was actually perceived by people from Hong Kong and new immigrants as not being Chinese enough, but I
Oh my
didn't
gosh.
but I didn't fit in with those who had just immigrated because I actually didn't speak English because my parents actually made the conscious effort as a second born because my older sister was having trouble switching from her first language of Cantonese to English, that they weren't going to let Amy have to go through that hardship.
Hmm.
Right.
I'm the middle of three girls, and my younger sister actually had a Chinese babysitter, so she speaks, and my elder sister speaks, but I am, as we call the black sheep, and I don't speak
Oh,
Chinese.
Oh
and you're the middle
no.
child too.
Yes,
I was
yes.
gonna say, oh no, were you born on Wednesday too?
I was born on a Friday, so there
Okay,
you go. We're good with
okay.
that. But so yeah, so it was fascinating just kind of looking back, how much I think there was, you know, I grew up in one part feeling very much like the visible minority and then actually became kind of the visible majority, yet still didn't fit into either group. But it's almost like I made a conscious effort at some point to really almost embrace the white adjacency, and really try to be as quote unquote Canadian, i.e., white, as I could be in my
Right.
mannerisms and how I dressed, to really try to be able to fit in with one group. And so that was kind of high school. And then, you know, throughout, I went to Montreal for school and everything. I didn't really feel like race was a big part of my everyday discourse or thought process. I lived in residence there. Again, there wasn't a lot of Asians. There there weren't a lot of Black or Indigenous students, but didn't really feel like it was at the forefront. And I think as you grow older and wiser, you realize maybe some of these things. But COVID-19, this pandemic has really, I think, heightened the awareness and made the awareness so acute in terms of race and race relations. I have to say, I have been deeply impacted by the Truth and Reconciliation report and Black Lives Matter that started actually in 2013.
Hmm.
And I've been doing some of the reading and work just as a medical educator. So I was faculty at a medical school and was actually engaged in trying to institute some um, cultural safety education for medical students and was doing a lot of reading and learning and truthfully unlearning because I remember asking myself back in 2013, like, why did we not learn about the history of the residential schools? I went to school in Canada and we didn't learn
Hmm.
about this awful past. So, you know, it's been about a 7 or 8 year journey and just kind of doing my own work and really wrestling with, wow, like there's a lot about the history of Canada and the structures that are in place that I didn't know as a Canadian student, and delving into that and why that's the case. And then you fast forward to this year where it was kind of like this perfect collision of both COVID-19 and Black Lives Matter
Hmm.
part three,
Hmm.
unfortunately, and this racial reckoning that's come from this. And you know, at the very beginning of the pandemic, I was advocating for my patients who many of them were essential workers or are essential workers. And I was in a very diverse neighborhood in Northeast Calgary, which, if you look at the demographics and COVID-19 rates, it's actually the highest proportion of people in Calgary who have COVID-19 live in this part of the city that my clinic was in as a family
Wow.
medicine physician.
Hmm. Hmm.
Yeah, and I think, you know, that's being repeated in Toronto and in Montreal and in, you know, Vancouver, the Lower Mainland, and we're seeing this over and over and over again. But my patients, many of them are racialized. I have had the absolute privilege of taking care of Syrian refugees that came because we were one of four clinics that took on new refugee patients at the time when there was a surge in the Syrian refugees coming to Canada. And just what a privilege to learn from them and from their life experience and everything that they've gone through. But it
Mhm.
was during the lockdown in March when they were coming to me saying, I don't feel safe. I don't feel like my employers actually think that we're worth making sure we're safe with either masks or, you know, decreasing our risk of crowding. They were scared. And also because of their chronic diseases, they were scared that if they got COVID-19, they would then get really sick. And also, they didn't have a lot of paid sick leave. And so I was writing letters and phone calls to employers saying, you have to keep my patients safe. But
Yeah.
they also felt like they weren't allowed to speak up. They felt like they were given the message that they were to keep their head down.
Wow.
I feel like that's a really common theme for racialized groups, they just have to keep working because there aren't very many options out there for them.
Yes. And it's heartbreaking to see. And as a family doctor, trying to honestly just try to keep my patients safe, every employer that I spoke to, it was really disheartening because at the end of the day, we're all human beings and we all, especially with COVID-19, I think it really brought to the forefront that we all have the same fears. We're all at risk of this mysterious illness at the time back in March and April.
Mhm.
Why are we not doing everything we can to protect each other? Because this is something that we're all at risk for.
Mhm.
So it was really, I wouldn't say it's eye opening, but it was really disheartening to kind of be forced to really look at and think about how even in Canada we treat racialized people, we treat populations that are new immigrants, and that wasn't really a good feeling to have to process. And then you
Mhm.
lay that on top of the increased anti East Asian sentiments that were going on with regards to, you know, um, people of East Asian descent being linked to the virus or, being accused of bringing the virus. And talking to my parents with regards to their safety, that they shared with me last spring that they actually, for the first time, felt scared for their own physical safety for the
Yeah.
first time in the 50 years that they have been here, simply because of all of the increased violence that was happening, especially in Vancouver, where Chinese people were literally in their cars and they were being attacked. And that brought out their story about immigrating here and what it was like. And all of that happened even before the tragic lynching of George Floyd. So
Mhm.
that's
Mhm.
kind of in a nutshell where all of this kind of culminated towards in June for me.
Yeah, I think you touched on so many important issues. And I remember back in high school when SARS first came to Canada. And I remember experiencing episodes of racism where people would look at me and say, go back to China, take SARS back with you. And like up until that point, I had really been kind of sheltered in terms of racism. But I think that was for me my first experience that, really stuck in my mind. And with COVID-19, I know that there was a period in Toronto, at least, where people were shunning Chinese owned businesses. And, it was being called the Wuhan virus, the China virus. And that really has a negative connotation. And I think just really set the tone for what we as East Asians face in terms of racism and sort of being unfairly accused of things like that.
Yeah, like I was thinking just kind of like, as in BC, you guys were having the crisis with the Syrian refugees. Like out here in Windsor, it was the migrant farm workers and
Right.
the massive outbreaks that they were having, the treatment. There were lots of calls for people to look into it, and it almost like fell off the radar. So
Hmm.
there was lots of people talking about it, fired up, and then it was kind of like radio silent. And we know that these people, they're immigrants,
Yep.
they're coming here to work, they're not landed citizens, but the thing
Right.
is we're still treating them as less than human. And it's just
Absolutely.
the fact that we can get away with this is incredible. And I get it speaks to the whole issue of systemic racism, and it's really scary. And let's call a spade a spade. The last 4 years, we had, well, not we, but like the world had a madman running the US government. Donald
Yeah.
Trump was a sociopath, racist sociopath, running the government for 4 years. And there are people, a good chunk, half of them almost in the States, that wanted to reelect this person. So we have to know that these ideologies aren't just for a select few people, right? And
Yeah.
this is the things that we have to continue to combat, continue to talk about and advocate for. And I feel like with the whole Black Lives Matter movement and kind of what has happened with the, I guess it would be like the anti-Asian racism as well, with Trump talking about it being the China virus and all these horrible things and despicable things that he was saying, that it has actually brought us closer together. So I hope that we'll talk a little bit about what East Asians are doing for the Black Lives Matter movement, but I think Sarah has actually another question for you.
Well, I guess it's a little bit of a different topic. I was just sort of thinking in terms of the isolation that people are facing, particularly with palliative care, because we say in healthcare and just even in general that nobody should die alone, but it seems to me that, at least in my experience, that is happening very, very more frequently. And I just wondered, in your practice, like how has this changed? Like, how are people sort of coping with this thing that's happening, where you may not be able to have any of your family members with you during your last moments?
So that's, if I were to lump kind of the three major themes or crises that have converged, is that's the third one in terms
Hmm.
of complicated grief and risk. Because I, as a hospice physician, have unfortunately seen the heartbreak of these restrictions and what it has meant. And I've been a hospice physician now for, it's my 17th year. And I've always said to patients, when I see them at home and do home visits, and then something happens where, caregiver burnout's an issue and they want to be able to be at home as long as possible, but really it's practically not possible, and families have to struggle with not allowing the patient's dream of dying at home to come true. I really try honestly to try to assuage their guilt by saying, hospice is as home like as it can be. We can offload the caregiving so that you could focus on your relationship, because time is limited, and that's actually the most important part, and that's the part that's irreplaceable. Healthcare workers cannot do that part for you, but we can make sure your meds are on time, and your hygiene is good and you're safe. But the actual relationship and the relational things that happen that are so precious at end of life, it allows families to be able to do that. And that's the essence of hospice care. And that now is completely interfered with the visitor restrictions, where literally people are allowed to come for limited hours a day, one at a time, with the mask. And it's heartbreaking.
Yeah.
And that's part of the reason why I've been advocating for COVID-19 safety, on top of advocating for my patients' safety, is the more cases go rampant in the community, the more we will have to continue to restrict visitors into hospices and long-term care, where people are going to die without saying goodbye in real life. But also think about all those people who are going to be carrying that for the rest of their lives, who have survived their loved one's death and have regrets and have had to go through the pain of being separated and have only very short snippets of time with them at the very end, which is not natural. And then think about healthcare workers like my team. I run a hospice now, and my team is really struggling with this, that this is not what hospice care is about. And we
Right.
are unfortunately forced to have to put limitations to visitors and have to help families through and struggling through that grief, on top of the fact that it's a terrible time in their life. It's been really difficult, to be totally honest.
Yeah, like I was actually thinking, and this is not really in line with the questions that we had for you, but it's just a thought that came to my mind. So one of the things that is kind of a buzz here in Ontario is talking about these kind of triaging guidelines, I'm sure with each province has something similar, but I think specifically with Ontario, one of the things they were talking about, if it ever was to get to a stage where, we were over capacity, we were out of resources, that they might have to move to this kind of triaging model. And one of the things that I was most scared of is really, how do we prevent discrimination from occurring when it comes down to the fact that, and I want to be very careful with saying this, because I don't think it's a lack of care, because I think we always continue to care. But if it was about resource allocation, that, someone might receive a ventilator, but someone might not receive a ventilator. And to me, that whole concept is really concerning, especially when it comes to race, and when it comes to marginalized communities, and when it comes to disability and various different things. And I just kind of wanted to maybe even ask you, what are some of your thoughts, or like, how do we even begin to have these conversations? Because I think here they were proposing that it would be a team of 3 people, the MRP, it would be the MRP, an ethicist, and I guess another involved physician. It might be ICU or whomever that would be consultant with, maybe ED, that would be making these decisions. But with your expertise of palliative care and with understanding racialized groups, like, how do we have these conversations? Like, to me, it's a pretty scary thing.
Yeah, I think it will be such a burden of moral distress already on top of the unfathomable amount of moral distress and moral injury I think healthcare workers across the world, but in Canada are facing right now with what we've
Mhm.
seen over the last year. And that's not just caring for COVID patients, that's caring for any patient in the
Yes.
healthcare system because, and I think this is something that gets missed in a lot of the discourses. Every Canadian who needs healthcare is negatively impacted by this virus and this
Right.
pandemic.
Absolutely.
And I think people forget that. And because they say, oh, well, it's only 1% of the population or some ludicrous number like that. It's like,
Yeah.
no, if you get in a car accident and the hospital's overwhelmed, you might not get a bed in the ICU
Right.
if you need it, right? And so, absolutely, I think that is every healthcare worker's worst nightmare to think that we would
Mhm.
have to be in a wartime era where we'd have to ration care. I think careful ethical frameworks that are simulated through and case based before has to be part of it. But the fact of the matter is, we know that COVID-19 is already disproportionately affecting racialized people because of
Yeah.
systemic racism that has allowed chronic disease to be more prevalent, but also potentially less managed.
Mhm.
So you have layers, right? Because if a tick box is, whether or not this person has these chronic diseases that make them physiologically less um, optimistic to be able to survive
Yeah.
an intubation, it's not that at that moment there's racial discrimination, but by factors that are beyond one's control because of systemic racism,
Right.
they may then be more at risk. And so it's layered upon layers and layers and
Mhm.
layers. And so, really, I really hope we never get to that point. I really sincerely hope because I don't think, I honestly, I don't know how the healthcare system will recover from something like that.
Yeah. Like,
And I
I
think
don't.
this is really like unprecedented, right? Because even with SARS, it was just a fraction of the cases we're dealing with, and the amount of time that SARS really took hold was much shorter. And
Right.
I think about that 1% that you just mentioned because it makes me so angry when I see
Yeah.
comments online where people say, oh, it has a 99% survival rate. Well, it's not just the 1% that passed away, it's all the other survivors that have these long-term symptoms that we're still continuing to learn about on a daily basis. And like you said, there's the secondary deaths that come about where either people are not wanting to seek healthcare or they seek healthcare and they can't get the treatment they need. It's just looking at the bigger picture here. And I just,
Absolutely.
it's just systemic. I think people just think of the numbers. And when someone of color gets COVID, we're not starting on a level field. Like you said, they already have all these compounding issues that put them at a disadvantage and continue to disadvantage them. And I think about patients that don't speak English and they don't have anybody. Like, how do you even communicate properly when you're in that state? And
Yeah.
Absolutely.
I'm just wondering, like, in your experience with some of your racialized patients, like, what are some of the other struggles you have seen them face with systemic racism in the healthcare system?
This has actually been right in the forefront nationally, just with the 2-day summit with regards to Indigenous health. The complete distrust, and for very good reason, of Indigenous people for the healthcare system, because there have been, even in this last 12 months alone, there have been way too many tragic examples of people of Indigenous descent going in for healthcare and being so racially biased, so racially harmed because of racist bias by healthcare workers that they die of symptoms that could have been actually treated simply because of racist harm. And that is heartbreaking. And I have patients who have had experience after experience after experience of saying, you know what, this government institutions, the system has always worked against us. Why would I trust them? And I think that is, has been a very humbling experience to help my patients, and that they have been able to open up to me about some of their trauma that they have endured, that their family has endured, has been so humbling, and really, I think, makes me even more focused on being part of the solution and not trying to perpetuate some of these harms.
Right.
Mhm,
And I mean,
mhm.
when I kind of think about it, I always it sometimes how even the media spins it, and when we talk about like vaccine hesitancy amongst racialized people, I think we really need to put the onus back. It's not actually of it's not like it's the black people's fault or the indigenous
Mm-mm.
community's fault. It's the government's fault.
Yep.
There's a
Yep.
reason why they're feeling this way, right? And I think this is that history of the bad treatment and the present history of bad treatment. Like I
Yes.
think with us seeing, in the States of Dr. Susan Moore, her treatment when she was palliative and she was sitting there recording saying like this is happening today. This isn't just what happened, you
No.
know, 100 years ago. This is happening still today. So the present
100%.
is still here, and we have to acknowledge that the fact that we need to hold governments, policies, institutions accountable for the systemic racism for why people might have the feelings that they do have.
And that includes the healthcare system, because that we
Absolutely.
are part of the colonial system that has propagated ongoing harm.
Mhm.
And so again, how do we, work, because it is an it is an uphill battle working within the system, let me tell you. But how do we continue to persist so that we can help? And it means right on the ground that we call in colleagues that we when we hear racial bias, like, oh, this person, you know does this person really have pain, etc. Like, we need to be actually having these conversations on a person to person level, on top of the systemic changes that are needed, because I think it's kind of both. It's the system, but also the interpersonal level, that changes have to be made on every level.
Yep,
Mhm,
absolutely.
mhm.
I'm gonna throw in one question before we get to the like, what are some of the tangible things that we could do? I'm gonna actually circle back to the conversation that we had when we were talking pre, and I hope this isn't too much of a surprise because like we kind of already talked about it a little bit. But I do want to talk a little bit, and maybe Sarah, you can jump in too, just a little bit about kind of like, um, I guess the background history of East Asians and understanding the whole Black Lives Matter movement. And one of the things that people used to ask me too was like, well, we see a lot of allyship with other groups, but we don't necessarily see it as much with East Asians. So could you guys maybe speak a little bit to that and kind of what that actually looks like and why it's changed since COVID-19 as well?
So yeah, so I mean, I will say full disclosure, that's part of that painful work that, us Asians have to do if we are really to be anti-racist allies or co-conspirators or co-disruptors. Because the fact of the matter is, for me at least, and thinking about this really deeply for the last many years, but especially this last year, just thinking about, you know, East Asians have had a small taste of the racism, the overt racism that Black and Indigenous people in Canada never get reprieve from.
Right.
Absolutely.
And I'm not trying to downplay the fact that it has been terrible and violent for many East Asians. But the fact that there's an ebb and flow, I think we need to actually be thinking about why that is, and that's because of the systemic racism that is just ingrained in the systems against Black and Indigenous people in Canada. And
Mm,
so we are in this weird place, I think, where we have been harmed by racism. We know what it feels like, but we haven't been harmed to the same extent. And this might sound provocative, but we haven't. And I'm going to say that we haven't. But
It's very true.
I think, my immigrant parents, they did the best they could with these race relations. But they also bought into the what we call the model minority myth. And the reason why it's a myth is, this keep your head down, work hard, don't, make the white power structure mad at you and you will succeed. I think that gets passed down from our elders who came here really trying to make the best they could with a decision to come here in their early 20s, which is scary in and of itself, and try to fit in.
right.
But if you look at the model minority myth, it's actually part of the white power structure that's meant to silence us. We're paying by keeping our head down and being silent
Hmm.
and being propped up as, oh, see, look at this Asian person, this Asian immigrant. This person's done well, so why can't you do well too? And so we're actually used as a prop to almost weaponize people of color against each other.
Yeah.
And it's
Hmm
just so, it's, when you think of that way, it's so distressing to be like,
Hmm.
wow, I have been complicit in this. Not
Absolutely.
not knowingly, but when you unpack it, it's really hard to actually sit with that and that shame and that despair. And so that's really what fuels me now, is to be no more, like no more silence. I am not paying this price because that price is not acceptable. And
Yeah.
I
hmm
will call it out. I will call it in. I will speak up because we need equity for everyone. I refuse to benefit from a structure that pits one social constructed group, socially constructed group against another for their own gain. I won't
hmm
be part of that
Thank
anymore.
you, thank you.
Amen.
I appreciate that, and the thing is, like, that is what allyship looks like, right? It's about calling it out, and I think even today, just as I was kind of like, versing Twitterdom, they were talking about, physicians being silenced a lot and not feeling that they can speak out even when it's their colleagues that might be saying something untoward, that it's just like, even within that medicine group that is kind of like, if we see something racist or whatever, that, it's just, even we might have them on Twitter, but we're not going to call them out because they're respected in their field. And the thing is, no, at the end of the day, we advocate for, whether it's not just for our patients, it's for our colleagues, it's
Yeah.
for the greater good, it's for other racialized groups. We have to keep calling it out. That is what allyship is about. It's saying when you see a transgression that you're like, no, full stop, this is unacceptable. And I am thankful that even within your own discomfort, you're saying that, "You know what? I've gotta do something. I've realized that history has a lot to play, but I'm going to try to do better, and I'm gonna continue to learn and move and pave the way forward for other East Asians to see me as an example as what allyship looks like." So, thank you.
Right, right. And Dr. Tan, I just wanted to circle back on something you said earlier, which is just in Chinese culture, it's very much ingrained that, you know, you go to school, you get good grades, you work hard, like you said, you keep your head down, and good things will happen. But I think the part that's missing is that we don't really advocate for things that are important. And like maybe it was a survival mentality for our parents and our grandparents, but I feel like I'm in this position now as a second generation Chinese Canadian that I can use my voice to advocate and to show other people of Asian descent that it's okay as well. Like we need to do this, and I almost feel like maybe some people are afraid to because we don't want to feel the retaliation that may come from speaking up about Black Lives Matters or Indigenous rights because we are a minority, although we haven't felt the brunt of it as some other groups have.
Yeah, no, and I'm not gonna pretend that it hasn't been hard personally, but at the end of the day, what I always say to myself is I want to be on the right side of history, but more importantly, I want to be able to sleep at night.
Yep,
Hmm.
And you know, there's no quote unquote two sides when it comes to racism. There's only
yep,
one side. And unfortunately, somehow again with the white power structure, people believe that there's two sides. No. No, there's one side.
yep, absolutely.
And so if people are having trouble seeing it, you know, it's unfortunate and they need to do the work, but I will keep pointing it out now. And it continues to be disappointing when fellow healthcare workers, physicians, educated, play into this model minority
Mm,
and would rather placate the power structure than to actually fight for equity for all. And I really find that very distressing, to be honest, and it's happening literally to this day where I am paying some personal cost to be able to say no, I'm not going to take this anymore.
yeah,
And I don't mean that like I know I'm this is very minor in terms of the cost, but what I'm just saying is I don't want, in trying to encourage other people to speak out, I'm not trying to make it all, you know, rose colored glasses and, you know, this is the way. And it is hard, but I
Hmm.
really firmly believe this is the only way forward, to be able to ensure that we have equity for all and true equity. We need to keep fighting, and we need to channel this weird space that are in where we are racialized. We do have some racism. We are reminded at times, and it hurts, that we really aren't whites. Although at other times we are considered white adjacent. But again, it's not really for our benefit, even though we benefit from it. It's still for the white power structure to
right.
benefit. And we have to remind ourselves of that. And so it's never going to change if we don't continue to call it out and just not condone it anymore.
Yep,
Hmm.
absolutely. So, what are this is, of course, it's the $1,000,000 question, and of course, it's never easy to answer, but maybe we could take it in, like, what are some tangible, small steps, little things that we could do every day in healthcare, in medicine, as nurses, physicians, allied health? What are some of the small things that we can do to combat systemic racism in healthcare and in medicine?
So I'm in BC, and BC just came out with a report called In Plain Sight that speaks to present day systems and how anti Indigenous racism is perpetuated in BC present day.
Mm,
Start with reading that report. Start with reading it with an open mind and humility, as to the example after example of how anti Indigenous racism harms and creates worse health outcomes and even death for people.
yeah.
There are some very good recommendations there, but I think again, I went to school in Canada. We, you know, we didn't learn about intergenerational trauma. We didn't learn about residential schools. We didn't learn about the 60s scoop. I learned about that all as an adult. My son, who's in grade 6, he's now learning about it. And I'm grateful at least that there's some change with current education, but it's really having these hard conversations. They're not comfortable, but have these conversations with your friends, your colleagues, with your kids at home, but also do the reading. I just went to a webinar with the author of 21 Things You Might Not Know About the Indian Act, Bob Joseph. It was amazing. It was just this week.
Mm.
But read his book. It is eye opening as to how, again, the legal framework of Canada and the big origins of Canada were all based on racism against Indigenous people. And if you can realize that and realize the history of slavery of Black people in Canada, and you realize this history that is still, affecting things in present day, maybe one can open their eyes a little bit more to how this continues to perpetuate harm.
And I think those are all great steps. I'm so glad that you put the onus back onto the individual, because the one thing that happens sometimes with me is, as being a Black female, they're kind of like, why don't you tell me? And it's almost like this voyeurism, right? It's like they want to hear my horrible experiences for them to start making changes. And it's like, no, the onus actually is on you. You do your homework. You pick up a book, you find something to read. I can point you in the right direction, but the onus is on you to actually do some of this hard work to understand what's happening, right?
Absolutely. And there's so much. I mean, to be honest, if I could spend my entire day reading, how happy would I be? But there are there are so many eye-opening books. I mean, I can name some, but like How to Be an Anti-Racist is kind of the book that I keep going back to
Mhm,
for
mhm.
inspiration, but also to like strengthen my resolve that, this is the fight. Not even It's not even worth fighting. This is the fight that must be had.
Right.
Like, so I go back to that, but like I said, 21 as a Canadian, 21 Things You May Not Know About the Indian Act is key reading. There's many memoirs now written by Indigenous writers like Jesse Thistle, From the Ashes. There's also Desmond Cole's book. Like there, like you said, there's many things that one can do to educate themselves, but they need to do it. And like you said, it can't be on the backs of the trauma of the people who have endured it.
Right.
Right. And even if we're thinking about this from the lens of trauma informed care, every time someone has to retell their story, you're essentially re-traumatizing them. And that is the
Yes.
complete opposite of what you should be doing. You should be empowering this person, supporting them, and that is not what you need to do. You need to come to the conversation prepared with some background knowledge.
Yes, and I'm happy to answer questions once homework has been done or to engage them in a way to get started. But what I've found is, even just again with my East Asian racist harm, is oftentimes it's sharing, but it's beyond sharing. It's like I have to prove why this was racist,
Mhm.
which then in and of itself harms again.
Yep.
Hmm. Yep.
That is definitely like, I remember actually being in a situation where, like, I'm sitting in a room talking about diversity, inclusion, and equity, and I feel like I've now offended someone, and they're taken aback by it, and I'm now going through apologizing and be like,
Yes.
wait a minute, why am I
Yes.
apologizing? How did this happen? Like, how did the situation flip that way, where I was actually speaking my truth, and now this other person's offended and I'm apologizing? I think I will never do that again. For
Yes.
one, now I'll never do that again. I'll be like, no, you need to suck it up, and this is just a fact. And I think the other part is like passing the mic. So lots of these people, in power, influencers, that have that opportunity to continue their allyship work. And if they have that power, they need to pass the mic to someone else, pass it to that racialized individual, pass it to that person who might be from the Indigenous community that can bring a different perspective. There's lots of people out there that do talk about these things, and it's great, but we do need to talk about passing the mic to other people as well, to give them that openness and that time to speak.
Absolutely. And we need to ensure their psychological safety to speak.
Absolutely. Because there's a difference between inviting them to the table and actually allowing them to speak and hearing them.
Yeah.
Absolutely.
And have the safety to actually be able to be open and to actually belong. And it's
Yeah.
not just that you're at the table because it looks good.
Absolutely. I think actually I was speaking to a physician today at the university. Sorry, not today. It was last week Friday at the University of Toronto, and she was talking to me, and she said we don't even call them safe spaces anymore, because safe spaces is like white female feminism. She's like, we call them brave spaces, because what we are asking people to do is they might have to sit through something that is very painful, that they have to be self-reflexive and self-reflective about,
Hmm.
and they have to be brave, and sometimes they just have to sit in that discomfort to hear what is actually happening and take responsibility of it. So, and the
I
whole
love
word of
that.
calling it safe space is again reflective of trying to, re-traumatize a person who might be telling their story. So more of a brave space. So I took that from her, and I was like, yes, I'm gonna use that.
Yes, I love that. I'm going to
Mhm.
also use that if I may, because that's brilliant. That's exactly what it is. It's really about having um, courageous conversations. And it's courageous for everybody. It's courageous to actually have to hear about this. It's courageous to actually have to put yourself out there to say and call it like it is. Um, so everybody in that space needs to be open and brave. So that's beautiful.
Yeah. Thank you. Thank you. Thank you. Thank you so much for coming on our podcast. We are going to drop all the links, all the different books and different resources, because we want people out there to listen to them and to actually go in and do the work, do the hard work. This is how you start your allyship journey. And Dr. Amie Tan, Amie, we are so thankful that you came on our show today.
Oh, thank you so much for the opportunity to unpack all these complicated feelings. This has been wonderful. Thank you
Thank
so
you so
much.
much.